Prostate cancer is a disease that affects about 1 in 6 men. Health reporter Alicia Booth is here now with some new information about the effectiveness of the blood test for prostate cancer. And there have been doubts cast on this test.
You're right. A new study addresses some of that controversy surrounding the PSA test and whether it actually does save lives. Well, this new information is based on 1,700 patients seen right here in Cleveland at the Cleveland Clinic.
This is a big day for Brecksville resident Jeff Rolfe. The 53-year-old is having his last radiation treatment for prostate cancer. He and his doctors agree a routine PSA test is the reason he's alive.
Had I not had that done, I wouldn't be here talking to you today. I had no symptoms at all. So the idea of the PSA test being kind of a leading indicator was a very good thing.
Cleveland Clinic urologist Eric Klein has the evidence to back that up, though other studies have cast a shadow of doubt about just how effective the prostate-specific antigen test is at saving lives. Dr. Klein and his colleagues took a look at how nearly 2,000 of their prostate cancer patients fared in the last 20 years. Some were treated before the routine PSA blood test was around, and the others after.
And it's clear that patients who were diagnosed in the PSA era have a better prognosis than those who were diagnosed before PSA came along.
Just as the guidelines suggest, Jeff got a baseline test in his 40s and one at each annual physical after he turned 50. But he acknowledges some people would prefer just not to think about it.
What I would say to other men who are putting it off, not getting the PSA checked, stop. Go get the PSA checked.
I think the weight of the evidence, including our study now, really adds to the growing body of evidence that PSA screening does save lives.
Now, Jeff's PSA numbers were actually pretty low, but when compared to his baseline number, it was trending higher. That is exactly the reason why doctors say it's important to have that baseline in your 40s. And by the way, Jeff is running the New York City Marathon next weekend. Can you believe it?
Good for him.
We wish him luck.
And you know what? Hopefully this will encourage more men to just go get that test. It's kind of like women getting their mammograms. You just have to do it.
I thought exactly the same thing, and that is why Jeff wanted to share his very personal story in hopes of convincing other men to go ahead and get that test.
Okay, thanks, Alicia.